Hey, good morning. It's Dr. Sutures with Palm Beach Cosmetic Surgery. Inevitably, I always get asked about the difference between absorbable sutures and non-absorbable sutures. So let's talk about it. The biggest difference between the two major categories of sutures, non-dissolvable and dissolvable sutures, are whether or not they need to be removed later. Dissolving sutures are normally placed underneath the skin and they're dissolved by your body's natural inflammatory process. Non-dissolving sutures, even though they don't lose their tension over time, you do need to go back and remove them, which means most of the time they're placed over the skin surface. One major question I get asked is, are dissolving sutures inherently weaker than non-dissolving sutures? And they do lose their strength over time, but they lose their strength over a time where by the time they dissolve, your body is healed to the point where they no longer need the support provided by the sutures. There's different choices I can make on the type of dissolvable suture I use. For example, one choice is monacryl. It loses its tension at about 2 weeks after I place it, but it doesn't fully go away until about 12 weeks after I place it. Another option is something called a PDS suture, where it holds its tension, it supports your tissues for up to 2 months after the time I place it, but it stays in your body and isn't completely dissolved until about 6 months or even longer after your surgery. So sometimes after your surgery, let's say on a facelift, you can run your finger down your incision, after cleaning your finger, of course, and you can feel these little bumps underneath the surface of your skin, and those are some of the knots that I've tied. And occasionally, not uncommonly, the suture end will get pushed up through the surface of your skin. We call this a spitting stitch. It's very easily treated. You come into the office and I take little tiny scissors and I clip it. But the first question people ask me is, does that mean my wound is going to fall apart now that we've clipped that suture? And by no means, never does that happen. By the time the suture is pushed up through the surface of your skin, your wound is healed enough where it doesn't need the tension and the support provided by the suture. And even though the suture isn't contributing to wound strength at that point, the knot remains for a much longer duration. And we're just simply speeding up the process by getting rid of it manually. The goal is to pick the suture that provides the strength your wound needs to heal without scars, but doesn't linger around for too long and contribute to distortion of the final result. So as always, it's very important for you to sit down and talk with your surgeon about what to expect in terms of spitting stitches, whether or not stitches need to be removed after surgery, what happens if I feel a stitch as I run my finger down my incision line. It's important for you to know what to expect so that you know whether it's something to be worried about or just a normal happening with healing.